Hey, how's it going, guys? Saman here from All Things PT, and welcome to the part 1 of 3 series on lateral epicondylitis or tennis elbow. So this video is for somebody that has pain that's ranging from 7 or higher. So basically the pain is pretty debilitating and it really limits your function. So it's for one of those people that where the grip strength is really affected because the pain in the elbow really hurts to the point where easy things like even pulling a blanket starts to be painful. So you are someone that is really affected. So this video is for you. Before we begin, let's talk about what is tennis elbow. So basically, tennis elbow, also called lateral epicondylitis, is pain in the lateral side of the elbow. So the part where the thumb is, the side where the thumb is the lateral side. What I want you guys to do actually is, let's see if this is visible to the camera. So put your hand on a surface or something. Act like you are typing something. So you should really see a muscle twitching right there. Okay. So this tendon right here, or this muscle, there is a muscle called extensor carpi radialis brevis. That's the muscle that is affected by tennis elbow. And what happens is it usually gets aggravated when people do activities such as that requires, I should say, gripping, a lot of heavy lifting, stuff like that. And especially if you do things too fast, too soon, that muscle tends to get irritated. And as a result, anything that involves gripping, anything that involves really elbow extension, especially if you grip and do an extension, that kind of hurts. So that's actually really how you find out if you have tennis elbow is gripping hurts. And basically if you were to put your arm like this straight and if you were to push and that exact spot where that muscle twitched earlier would hurt, and that's kind of a test to find out if you have tennis elbow or not. Before we even begin with the exercises, it's very important for people to realize that these exercises are not going to help if you keep doing the activities that's going to piss your pain. So basically, if you go to the gym, you gotta find a way to modify your exercises, especially during your back and bicep days where there's a lot of gripping and pulling. You gotta find out ways to modify your exercises. Maybe use a wrist straps, maybe use a grip straps, or the ankle straps. You can put it on your wrist as well, and you can modify a lot of exercises so that you're not pissing off your grip. Also, if you are working, especially in the construction and stuff like that, it's kind of hard to do any kind of modification. But if possible, get a note from your doctors with the lifting restrictions, or if you have to do it and you don't have any options, then you can always at least rest at home and not do yard work on top of your physically demanding job. If you are on a computer, make sure your computer is set up, especially the keyboard is set up more ergonomically. You are resting this as much as you can. The philosophy behind most of physical therapy sessions should be short sessions, but you got to make sure, if you are more consistent with it. These exercises are only going to last for a few minutes, but what I request and what I found success in patients is that if you do them consistently, 3 to 4 times a day, again, a few minutes, and these are exercises that you can do even if you are in a traffic light, okay? So first of all, for the sake of this video, because my camera angle is on that side, I'm going to assume my left side is my affected side, even though for most people it's going to be on the right side because most of them are right-handed, and in this condition typically happens on your dominant side. But for this video, we are going to assume that our affected side is the left side. Again, this video, part 1 of 3, is for someone whose pain is 6, 7 or higher, pretty debilitating. First of all, you are going to find that muscle that is twitching. So it's right there. That's where it's the muscle tendon is. That's where it attaches. You actually don't even have to take the sleeves out or anything. I'm just going to do it for the video. You're going to start with some soft tissue massage, especially when your symptom is aggravated. I found soft tissue massage is helpful, and the more advanced you get, maybe you want to stay away from soft tissue massage and be more towards exercise. Okay? So first you are going to again act like you are typing, and you'll find the muscle twitching, right? This is where you're going to push, and so you're going to kind of give a little bit of a gentle push in this down direction. You're not going to be super aggressive on this. So very nice and light. You are going to, one thing there is not really a right or a wrong thing, but what I would recommend is not going from the elbow side to the hand side. I wouldn't recommend pulling this way because it kind of stretches the muscle that is kind of aggravated. I would either go more perpendicular to the muscle like I am showing, or you can go from the hand side to the elbow side like this, okay? And you're going to do that for about 30 seconds to a minute. Again, there is not going to be a super right or a wrong way. Just don't be super aggressive. Just don't be super, don't put a whole lot of pressure. And you should actually be finding that spot, okay? It's pretty easy to find once you start kind of playing with it, because you are going to feel it. So don't be too aggressive, at least for the first few days. After that, what you would realize is that, I'm just going to move this aside, your symptoms, especially even if you're gripping something, when your elbow is tucked on the side, it's going to hurt a lot less versus if your elbow is extended like this, okay? So now that means when things are flared up, you want to do most of your exercise in this fashion. And once the pain kind of decreases, then you want to start going here. So what you are going to start, just to begin with, is some gentle stretches, and you don't even have to do a whole long stretches. You are going to be in this position, like I said, elbow bent, and you are going to pull your wrist like that. Hold this position for about 15 seconds or so, and then relax. Okay, hold this position for 15-20 seconds. You should be feeling a little stretch in this area, and then relax. So once you have tried it, you can then extend your elbow and then see how this one feels. And if this hurts, then go back to this. But if it doesn't, this will give you a little bit of a better stretch. So let's do 15-20 seconds right here. And relax. And 15-20 seconds right here. Okay, very good. So now, if the pain increases a little bit, that's okay, but you don't really want to piss it off. And a clear indicator that I tell my patients to find out if you overdid it or not is, while you are doing the exercise, it's okay if the pain goes up a little bit, but if the pain is worse tomorrow or day after tomorrow after you did it, then you definitely overdid it. So even though I said do it 4 times a day, what I would actually recommend is, if it's really hurting for the first day or two, just do it twice a day, once in the morning, once afternoon. And if you feel like it's not aggravating it or anything, then do it 4 times a day. So that's your second exercise. After the massage, we did this. If this isn't aggravated in the elbows bent position, then do it straight. And then the other one, all you were doing, and this is why I like the table or something, is then you are just going to do up and down like this, even without the weight. You would find that if you grip it will hurt more, okay? And so what I would recommend is relax the palms and just do this, without weight, without anything. 10 to 15 reps. I'm not counting, but I'm assuming, I feel like it's at least 10-15 reps, right? And so then, going to take a break. And then, second time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Okay, so again, you can massage this area just a little bit. And then after you're done with this, what you'll also find out is that same spot right there is going to also hurt when you pronate and supinate the wrist. So it's okay if you can't go all the way right here. So only go where you can comfortably, 10 to 15 reps. And this is what I want you to compensate. I want you to watch out for compensation. Is a lot of times in order to open the wrist, to turn the wrist, a lot of people will compensate like this with the shoulder, okay? And so that's something that you got to be careful of. That's why most of the people will have these kind of issues, especially in the middle joint, like your elbow or your knee, is when joints above and below, so your wrist and your shoulder, will do things to compensate, and the elbow will suffer or will have these kind of issues, okay? So just go to the point that you can without compensating from your shoulder 10 to 15 times. Here's the thing, if it hurts, you can kind of use the other arm and actually, same on the lateral side or on the thumb side, you can kind of push the muscle a little bit, push the bone just a little bit, and then do it. And then you will realize that it doesn't hurt as much. That doesn't mean you are really going to push it too much, but that's something that I would call like a cheat code that you can do to minimize the pain. So that's about it, guys. That's about, I don't know, 5-6 minutes. That's mostly because I was talking. But you know, just do a little bit of massage. It doesn't have to be really, you don't even have to expose the skin or anything. Again, make sure you just kind of go from the hand side to the elbow side, up and not down, and then you go side to side, 30 seconds to a minute, followed by either the bend your wrist and stretch 15 to 30 seconds, 2 sets. If this doesn't hurt, then progress to this. Then you are going to do open and close your, then you're going to do the up and down, wrist flexion, wrist extension with palms kind of open, with fist open, 10-15 times, 2 sets. And finally you are going to turn your palm up and down, so pronation and supination. If opening like this, just don't push through the pain, but if you do have pain while doing it, kind of use the other arm to push the thumb side bone muscle a little bit. You don't have to push too hard, just a little bit, and then kind of open. That's called mobilization with movement, 10 to 15 times, 2 sets. That's phase 1 of tennis elbow exercises. Again, 6, 7 or higher. Pain needs to be this is a pretty light exercise, okay? So pain needs to be significant. I had pain long time ago, tennis elbow, and it was to the point, that's why I said pulling the blanket hurts, because it would hurt to pull the blanket. So if it's that aggravated, you don't want to do super difficult exercises. Keep it light, keep this mobile. That's why I said do it twice a day for a day or 2. If it doesn't hurt, then do it 4 times a day. Keep this moving. Avoid activities that really pisses the joints, pisses the muscle up. So hopefully this helped. If it did, please make sure you click the like button. Please subscribe to my channel, because more videos on physical therapy coming soon. Second and third part of a tennis elbow relief also coming soon. So please subscribe. Until then, take care. Bye-bye.